when you call in, you're going to get an ask about identities, race, sexuality, gender, all of it, right?
Mm-hmm.
And they'll ask, well, hey, do you have any preference for what you were looking for to work on? Is it ADHD stuff, autism stuff? Is it stress stuff, eating disorder stuff, right? And if they say certain things that sounds like ADHD or autism, they're gonna, or social skills, right?
Mm-hmm.
Some type of dysphoria, they're going to push the kid towards me.
Mm-hmm.
So they're going to be like, hey, Nas is awesome, blah, blah, blah. This is his credentials. And then the kid says yes or no. So in the immediate consult, it is advertised that I'm the person that they can go to, which is why I see a high rate of folks that are autistic in my office or neurodivergent, because, right, they triage them to me. There's a few articles in Purdue that like I'm advertised about, but a lot of that's working with students of color, not so much as autism, because I work a lot with students of color too.
Yeah, and autistic students of color are particularly under-supported, so it's really important to make sure that they have people in their corner. Speaking of making sure we have people in our corner, how have you found the training for social workers and counselors around autism? Is it something that is available to the other folks in your office to learn? Is there professional development for you guys?
It's straight up trash, bro. You get like one paragraph of like, this is autism, and you're like, oh, okay. Wait a minute, what's autism? Oh, they're disabled. Oh, got it. Okay, yeah. So you don't really learn about autism. To be fair, in a lot of these fields, you don't really dig in a lot into a lot of the diagnoses, but autism, that's really on the back burner. When you're talking about DEI and diversity, equity, inclusion related like causes these days, autism is really not in the forefront of any of the things. Disability is not in the forefront of any of those things. It's usually going to be based on race, sexuality, and gender, which is awesome. But it's also we hold a lot of them identities too. And so when it comes to trainings, they're starting to become more now, but led by a lot of neurodivergent autistic folks. When it's coming to the programming, like coming out in school, the DSM and all that stuff, it's been reworked in the last few years. Still very lacking the DSM, the diagnostic criteria that we use as therapists. Like right now, I just did a training the other day for my staff on autism. And, I always feel like it goes well, but like, who knows? People always love it. But then I say a lot of out of pocket things. And so I can see my bosses like cringing when I say out of pocket stuff. So I'm like, it is what it is. Like, you can't tell me to mask my autism and then do an autism training. That just sounds wrong. And so I'm like, hey, you get what you get. You want me to do it? I'll do it. The cool thing is a lot of my homies in my grad programs. So it really comes down to us, not the administrators. So a lot of my homies will have me go in and guest lecture on autism or being an autistic therapist or a neurodivergent therapist. And so I've done it maybe like 5 or 6 times just this semester already.
Oh, awesome.
They usually give me like an hour and they just like, Nas, I don't care what you say, just let it rip. And I talk really fast because there's so much material. And it happens every single time as people will like unmute for questions and they'll be like, you know what, Nas? And I'm like, I know what you're going to say. They're like, I'm autistic and this has been an awesome training. This feels really validating and awesome. I just want to thank you. And I'm like, oh my God, stop. And then they'll ask me for resources and then I'll give them a ton of resources so they can do more investigating on their own. So it comes down to clinicians asking people to come in like, hey man, come in.
Yeah. So do you see students who are discovering their diagnosis for the first time? I ask because what you said about students unmuting and thanking you reminds me of what happens when I lecture on autism, which is, I feel so seen. This is often femme presenting people in particular. I feel so seen and I never thought it could be me, but I'm thinking it is. How do I get diagnosed? Does that happen to you?
Bruh. All the time. So there's a couple different things that come in my therapeutic office and in my private practice, which I run here in Indiana and Michigan, is folks come in for one thing. And I'm like, okay, you're tabulating all the stuff, boom, 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 boom. By the stuff, I mean, you're just collecting things that are abnormal. Trauma, anxiety, eating disorders, OCD, ADHD. Oh, there's a genetic component. Oh, your sisters or your brother's got autism. Oh, you've got some joint mobility. You go through everything. And you're like, hey, so there's a chance that you could be autistic. I'm going to send you some screeners. and we're going to figure this out together. And even if you're not, you're definitely neurodivergent because, and I don't say this in a bad way, you're not normal. Yeah. So, what is this thing that we're talking about and dealing with, so we can better identify it and then move forward? And so I get a lot of folks that are like, "Yo, I'm autistic. I need the help. I've always had help." And then I get the folks that come in with, "I'm just here because I got anxiety or OCD or trichotillomania, where you're plucking things, whatever it is." And then I'm like, there's some other stuff here.
Yeah.
And then you've got some folks that come in that I'm like, you know what? I don't think the diagnosis would be beneficial at this point. I'm just going to work for them on this one thing. And if they continue therapy with me, then we'll dive in how it could be some neurodivergent stuff.
Yeah.
So there's a couple different points. The middle ones are the funnest because it's like a coming, I don't mean this super religiously, but my boss would say this. It's a coming to Jesus like moment. You're like, so child.
Yeah.
You're autistic.
Yeah. Consider the possibility that these 10 unrelated things are connected to a single root cause.
What's that root cause? Autism. Oh, I'm not autistic. I was like, well, and if you're autistic, then mom or dad has to be autistic. Oh, no, my parents aren't autistic. What's your dad do? He's an engineer. Oh, yeah. What's his hobbies? He collects trains. Okay.
Yeah, I recently got an email from my dad titled, "I like trains." So, yeah.
Yeah, there you go, man. I come from a very neurodivergent family myself, going all the way back to legit to our homeland, which is like Lebanon and Palestine. And so you see the neurodivergence and the autism throughout the entire Arabic side of my family. And then you can see it on my mother's Hispanic side too. But I didn't know I was autistic and like firm in that belief till probably about 30. But I've been operating in this world as neurodivergent, as ADHD, tons of issues when I was in school. You think I would have known this? Behavior modification school for like multiple years, a lot of stuff. But my brother's been diagnosed autistic since I think he was like 5-ish, maybe 3-ish. So then I start getting older and older and older. I'm like, wait a minute, Dad. You're the autistic one. And he's like, no, I'm not. And I'm like, yep, you are. And then we'll have these moments where he's like, damn it, I'm autistic as hell.
Yeah.
It's pretty cool.
So what's your experience like helping people unpack that stigma? Because a lot of times that knee-jerk, like, oh, it's not me, comes from a lot of stereotyped information and the rampant disability stigma.
Yeah, so it comes from like this ableism stuff. It comes from, I don't want to be seen as disabled. I don't want to be seen as less than. I don't want to be seen as the R word. And so you unpack it as curiosity. You unpack it as, this is a thing already. I know your brain's different. We're just trying to figure out how different is it. So you come at it with like love, but also fun. So I'm a quirky kind of weird. And I'm like, well, I can't have autism because of this, and this. And I'm like, hey, I'm sitting right in front of you, autistic as hell, with a doctorate, and I can talk good and all this stuff, right? So I don't want to get in if it's disabling or not disabling, but because there's a lot of disabling stuff for me, but there's also I'm not like disabled where I can't executive function on anything. And so a lot of people think that executive functioning or cognitive abilities is tied into autism. Those are completely separate things that are also highly comorbid with autism, but it's not autism. There's a lot of stuff in that gumbo pot, what we call neurodivergent. But man, it's awesome. It's like when I'm working with a student of color and I get emotional sometimes because when you're working with your people, it means more. Like they call it transference or countertransference, right? And so you see yourself in that kid, that child, and you get to support them and like love them in a way that no one ever has. One of my men of color the other day cries. I ain't never cried in front of no one my entire life, and they cry in front of you, and you're like, I ain't gonna lie, I cried too. It is what it is. And they're neurodivergent too in a certain way. So it's impactful. I get my students that are autistic, and they may find out that they're autistic with me, and then they're like, man, I just vibe with you, man. This feels good. I had a student the other day that's just like, this is awesome. Like, I don't have to explain anything to you. Like, I don't even have to talk in complete sentences because you just know where the next sentence is going, or you can read all the other stuff where you always have to over-explain and then stutter and then deregulate because of the shame and guilt. And my office is completely unmasked. Students, I can see them trying to calculate what you say and how to say it. I'm like, just send it. I've been working with folks that go all the way from nonverbal to don't shut up. I'll figure it out.
Yeah, and honestly, sometimes that's the same individual in different moments of regulation, nonverbal to hyperverbal.
Yep.
Yeah, speaking of identities and feeling sort of cared for and healed in your own identity as somebody who holds many, there's a shortage of neurodivergent therapists, therapists of color, men in the healing space. What should students do if they're having a hard time connecting to a therapist that really understands them on that deep level, like you were describing?
So when it comes to students looking for resources and just overall getting therapy, I would not harp so much on some maybe the other identities, is to find someone that either works with neurodivergent kids, gifted kids. But if you can't find autism, just sync up with someone that works really good with ADHD.
Oh, okay.
If they say they work with ADHD, then they know the neurodivergent vibe. If they work really good with OCD, like the specialties in OCD, that would be magnificent to work with. Most of the profiles are going to say anxiety, depression. Magnificent. Okay. But if they got any type of specialty or like more in the ADHD or OCD range, it's going to be a little bit better at working with you. They may not understand everything, but the ADHD therapist, they're going to get it. And you don't normally develop a speciality in therapy unless you've already got one of those things. You identify with it. That's why it's your specialty. It's not always true. That's kind of a generalization, but most of us go into the work in which we feel like has healed us, or we feel like we want to learn more about ourselves or our family. So a lot of folks will go into trauma work. People go into trauma work because they usually got a lot of trauma.
Yeah.
I studied autism, right, and did my dissertation on autism specifically in women and how they present because I'm autistic. But also I wanted to take that population, then generalize it to all the boys. Because of what we call, right, the symptomologies are like different, right? We know that. So I would kind of start out like that. Don't be scared of any men or masculine presenting individuals. You actually might fit a little bit better because we're going to be a little bit strategic, our brains and how we work, a little bit more blunt. Where some of the other therapists that are women or femme presenting, they may make you sit in emotions a little bit more. They might make you like, how's that make you feel? There might be a lot of awkward silences because therapy is supposed to be focused on emotions. With some of us, we're like, hey, this is what we're talking about. This is the solution. This is what we're going to do.
Hey, thanks for watching this video. Check out the full episode on our channel and anywhere you find podcasts. Also, remember to like and subscribe. Whoop whoop!